Hello, I am Dr. Syed Munamm. I am doing my Masters of Science in Public Health from Health Services Academy, Islamabad. The topic which I am going to present today is my research paper, which is on the safety and efficacy of Sinopharm vaccine in elderly population of District Faisalabad in Pakistan. So let's start the presentation. I will be sharing my screen with you. I hope everyone can see the slideshow which I am presenting. So as you can see, the topic of this research article was to assess the safety and efficacy of Sinopharm vaccine in elderly population of Faisalabad, which is a district of Pakistan. A brief introduction. COVID-19 pandemic was declared in March 2020 by WHO. But the first case of COVID-19 was detected in 26 February 2020. Till now, it has become a major global public health issue, and by the end of 2021, it has infected almost more than 260 million individuals and has taken lives of around more than 5 million people around the world. By the January 2022, in Pakistan, we have almost confirmed 13 million individuals, and it has caused death among around 30,000 individuals since the start of this pandemic. Different pharmacological and public health strategies have been employed in Pakistan, which includes a social distancing, ventilation, adequate ventilation, use of face masks, as well as the pharmacological interventions, which include vaccines, has also been implemented. Sinopharm vaccine, which is an inactivated virus vaccine, is the main vaccine which is used by government of Pakistan. At the start of vaccination campaign, mainly the old individuals with comorbidities were selected for vaccination. To date, no peer-reviewed publication on safety and efficacy of Sinopharm vaccine have been published, which has a data of Pakistani population, specifically of older age group. So this study will be the first peer-reviewed publication which has a data showing the efficacy and safety of Sinopharm vaccine among elderly population. The objective of the study was to assess the safety and efficacy of Sinopharm vaccine among the patients of age 60 or above who were resident of Faisalabad, which is the district of Pakistan. For methodology, we applied study design, which was a test negative case control study. The study area was District Faisalabad, which is the third largest city of Pakistan. It is mainly located in the largest province, Punjab. It has a population of around 80 million and 8 million. So it is an industrial city and has well-built roads, airports, and a railway station. The duration of the study was around 3 months, which started from 5th May 2021 to 31st July 2021. We collected the data from COVID-19 dashboard, which is under the custody of District Disease Surveillance and Response Unit of Faisalabad, and also used the NADRA Immunization Management System data to confirm the vaccination status of our sample people. The study population was mainly the adults of age 60 years or above who were tested by our District Disease Surveillance Response Unit for COVID-19 using real-time PCR. In statistical analysis, we applied logistic regression to find out the odds ratio, which was later on used to calculate the vaccine effectiveness. The inclusion criteria was mainly all those individuals who were having age 60 years or above and were tested for COVID-19 by our teams. Exclusion criteria was mainly those adults who were partially vaccinated or those who had 2 doses of Sinopharm, but the duration of the second dose was less than 14 days. All individuals who were vaccinated by other types of vaccines such as Sinovac, CanSino, Moderna, or Pfizer were also excluded. Those individuals whose vaccination status were uncertain or we could not assess the data were also excluded. Individuals who were not happy to include in or to enroll themselves for the study were also excluded, and those patients who had a previous history of COVID-19 were also excluded from the study. If we talk about the outcome, the primary outcome was to see how many patients, PCR confirmed symptomatic COVID-19 patients, were found among vaccinated and unvaccinated individuals. And secondary outcome was to see the prevention of hospitalization and mortality due to COVID-19 among vaccinated and unvaccinated individuals. The vaccine effectiveness was calculated using a formula 1 minus odds ratio into 100. Talking about the results, we can clearly see that COVID-19 was mainly found among non-vaccinated individuals more as compared to fully vaccinated individuals. If we see among the females, 91% of the unvaccinated females showed positive PCR results for COVID-19, and only 8.7% fully vaccinated females showed positive results for COVID-19. Among the males, 88% of the individuals who were not vaccinated against COVID-19 showed positive results for COVID-19 on PCR, and only 12% of the males who were fully vaccinated showed positive results on PCR. This table shows the vaccine effectiveness along with the 95% confidence interval and the p-value for statistical significance. The first row shows the symptomatic COVID-19 patients, which shows that vaccine prevented symptomatic COVID-19 disease among 94.3% of the individuals, having significant p-value of 0.001. Not only that, it prevented the symptomatic disease, it also prevented hospital admission among vaccinated individuals by 60.5%, which was also having a p-value of 0.05%, 0.01, and 95% confidence, which was also found to be significant statistically. Vaccinated individuals, vaccine showed effectiveness of 66.1%, but this effectiveness was found to be statistically insignificant, mainly due to low sample size. If we talk about the mortality, the vaccine prevented mortality among vaccinated individuals by 98.6% with significant 95% confidence interval of 94.2 to 99.6% and having p-value of 0.001. Now, if we compare the phase 3 trial of Sinopharm vaccine, it only included young individuals, and only 1.5% of individuals were having age greater than 60, and only few of them were having some comorbidities. This phase 3 trial showed vaccine effectiveness of 78.1% in preventing the COVID-19 symptomatic disease. In our study, the interesting point was that we had older age group, and most of them were having comorbidities. The interesting finding was that patients who were having comorbidities were more anxious for getting vaccinated. So 89% of the patients with comorbidities were vaccinated, and only 36% of the individuals without comorbidities were found to be vaccinated. If we compare the deaths, 86 individuals among unvaccinated group were died in our study due to COVID-19, and only 2 patients among the vaccinated individual groups were died due to COVID-19. If we compare the real-time world data, we can see that in UK, a study was conducted among 150,000 individuals, which showed Pfizer efficacy of 90% and AstraZeneca efficacy of 73% in preventing COVID-19 symptomatic disease. In America, a study showed on efficacy of Moderna to be 93% against hospitalization. Sinovac vaccine, which is similar to Sinopharm, showed effectiveness of 65.9% for preventing symptomatic infection, 87.5% for preventing hospitalization, and 90% for ICU admission due to COVID-19 disease. It also showed effectiveness of 86.3% in preventing death, and this study was mainly done in Chile. If we see the side effect, only 0.5% of the participants reported adverse events after the first dose, and around 0.36% showed adverse event after the second dose. The most common side effect recorded was the injection site pain. So the conclusion, our study concluded that Sinopharm vaccine is highly effective in preventing infections due to COVID-19, hospitalization, and mortality due to COVID-19 in patients over 60 years of age. This shows that Sinopharm vaccine is not only effective among younger age group, but also highly effective in preventing symptomatic COVID-19, hospitalization, and mortality due to COVID-19 among older age group with comorbidities. So this was the end of our presentation. I would like to thank ICMMGH for providing me this platform to present my research paper for you guys. Thank you very much.